Should we or shouldn't we test for our cholesterol? A lot of people, think cholesterol is one of the most important things for a predictor for heart disease, um, or for strokes and all that kind of stuff, and we should make sure to get our cholesterol down. From what I've learned from Dr. Natasha Campbell McBride, the author of the book Put Your Heart in Your Mouth, she advises to not even test for cholesterol, and that it's actually a pointless exercise and potentially actually a harmless one. And I'm going to explain why from what I've learned from her. Because basically, your blood levels of cholesterol are maintained by your liver. So when we eat more cholesterol, the liver produces less, and when we eat less cholesterol, the liver produces more. That is why low-fat and cholesterol-free diets basically have no effect on blood cholesterol. Your liver will maintain a particular amount of cholesterol in your blood depending on what your body is doing at the time. So, like we talked about in some previous videos, basically, why do we need cholesterol? The more I learn about this, the more I see the absolute necessity that every single person needs to be consuming cholesterol, needs to be eating a cholesterol-rich diet, and definitely needs to not be taking a cholesterol-lowering drug, as you'll see again in a minute here. So our body needs cholesterol because it's such an essential part of our human physiology that the body has very efficient mechanisms to keep blood cholesterol at a certain level at any given moment in time. However, the cholesterol-lowering drugs such as statins basically present a completely different matter. They interfere with the blood's ability to produce cholesterol, and hence they do reduce the amount of cholesterol available for the body to use. So you'll be able to just see basically how dangerous that is when it comes to the brain, which is hugely hungry for cholesterol, the immune system, and all sorts of things. So firstly, the brain. The brain is a huge user of cholesterol and saturated fat, not only to build itself, but also to accomplish many functions. If you started to interfere with the body's ability to produce cholesterol, you put the very structure of the brain and the rest of the nervous system under threat, according to what Dr. Natasha writes about. Memory loss is a big one here. Memory loss and cognitive decline are very common results of statin therapy. In fact, it is possible that a considerable part of the dementia epidemic in our aging population is due basically to this huge, ubiquitous amount of statins being prescribed. When basically everybody, including people that are getting older and maybe you see a decline in their memory, particularly those people should be eating lots of fresh eggs and butter daily, because it's been shown to actually increase memory, improve memory, and your cognitive ability, particularly in the elderly. So any person with memory loss, learning problems, definitely needs to be eating plenty of these foods every day to prevent that. Low cholesterol also has been routinely recorded in criminal activity, people committing murder and other violent crimes. So people with aggressive, violent personalities, people who are prone to suicide, and people with aggressive social behavior and low self-control, all related to low blood cholesterol levels. It's not looking good for being worried about if your blood cholesterol is high. Also, cholesterol is super important for protecting us against infections. They've actually shown that people with low blood cholesterol are more prone to infections, whether it's a virus or a bacteria or even a fungal infection. And when they get an infection, they are more likely to die from it compared to those with high cholesterol. And actually, before the discovery of antibiotics, a mixture of raw egg yolks and cream, which is very rich in cholesterol, was used as a cure for tuberculosis and other infections for centuries. Also, another major thing is a lot of people, interested in losing weight, being healthier, and just feeling and being younger. A lot of that is due to your hormone levels, particularly your sex hormones. and your sex hormones and your adrenal gland, which produces a number of hormones, are largely dependent upon cholesterol. So after the brain, the adrenal glands and the sex glands are very hungry for cholesterol to produce these hormones. They produce steroid hormones, which accomplish a myriad of functions in the body. One being weight loss and being younger or being youthful. Without cholesterol, we would not be able to even cope with stress or even to actually have children. Another essential thing with cholesterol is that cholesterol is essential for babies and children. As I talked about previously in another video about the whole diet heart hypothesis that started back in 1953, I believe it was, with Ansel Keys, that said that cholesterol and saturated fat are connected to heart disease, which has just been totally debunked since then. But these proponents of the diet heart hypothesis and the public policy makers tell us that our children from the age of 2 should basically follow a program of reducing their blood cholesterol by avoiding natural fats and replacing them with margarine. And the thing is, with children's bodies are generally not, because they're not fully developed, they're generally not able to produce enough cholesterol for growth and development. So eating cholesterol-rich foods is essential for children. And that is why human breast milk is very rich in cholesterol. As mentioned previously about how essential cholesterol is for the elderly, they've shown in many studies that old people with high cholesterol are healthier and live longer than people with low cholesterol. And in fact, it is actually dangerous to reduce cholesterol in the elderly. And yet that is exactly the opposite. That is exactly what the general medical practice is doing with the elderly. They're actually reducing the cholesterol. So the older the person is, the more their low blood cholesterol poses a risk for stroke. Well, it is basically clearly demonstrated that high blood cholesterol protects older people from strokes, heart disease, infections, cancer, and many other health problems. And also another huge important supplement is vitamin D. Your body actually can't produce vitamin D naturally apart from cholesterol. So when your body, when you're out in the sun, when it's warm out, when you have about 40% of your skin showing and the UVB rays hits your skin, your body will actually produce cholesterol from that process, anywhere from about 10,000 to 40,000 units of vitamin D in about a 20-minute exposure. And vitamin D deficiency is related to a myriad of health conditions, whether it's cancer, diabetes, heart disease, mental illness, autoimmune illness, obesity, bone and muscle disease, high blood pressure, chronic pain, poor immunity, and susceptibility to infections. So if you're not able to get adequate sunlight, if you're maybe living in Vancouver like I am and you're not getting a lot of sunlight, definitely take a vitamin D supplement, 8,000 units a day to get those levels up is crucial for optimal health. And another major thing about cholesterol and saturated fat is they're essential for healing. So no damage in the body, no wound or scratch can be healed without cholesterol and saturated fat. That is why basically large studies have found that people who have actually low cholesterol levels are actually more prone to cancer, basically because their bodies cannot heal the damaged tissues. And essentially, like it is this function of healing that brings us back to the question in the beginning about whether you should get your cholesterol tested. All of your blood levels reflect how much damage there is in your body at any particular moment. That basically has to be healed. So if you're fighting off an infection, if you just had dental work, if you just had a surgery procedure, that's going to produce a lot of damage in your body. So therefore your body is going to need to heal that. So your blood cholesterol levels are going to rise to accommodate that. But it's not a problem that your cholesterol levels are high. It's just because there's repair that needs to be going on. If you're tired or under stress, your adrenals have a high demand for cholesterol as they have to make the hormones that we talked about, whether it's cholesterol or whether it's cortisol, whether it's adrenaline, all those types of hormones. So your basically liver actually will have to produce more cholesterol to deal with the healing from the damage that's going on, and to deal with you being tired and being stressed. And also in winter months, when it's winter, your cholesterol is going to be higher, and then when it's summer, your cholesterol is generally going to be lower because the cold weather and the lack of sunshine. Vitamin D places a high demand on your immune system, which is, like I was saying before, your body is very dependent upon cholesterol to make vitamin D. So those are just basically a few scenarios when your blood cholesterol has to be high to serve your body needs. So if you get for instance, if you get a blood test one day and your blood cholesterol is high, but then you got the blood test maybe a couple days later and it's going to be low. So your blood cholesterol is going to be going up and down all throughout the week, but it doesn't mean because it's high that you need to be taking a statin to get it down. Maybe it's because your body's, like I was saying, you have a cold, you have a flu, you had dental work done, you had a surgery that your body needs to repair, so it needs that cholesterol, so the body pumps out more. Or, like I was saying, you're stressed, you're tired. So the problem with this is that blood test is only going to give you a small, basically, snippet of information, which is going to be completely out of context of your body's needs at the time. If the snippet happens to find it high, so like basically if you're doing the test and it finds the cholesterol to be high, then two harmful things can happen to you. One, you might be pressured to go on statin therapy because your cholesterol levels are high, basically depriving your body of this most essential nutrient. You might be put under that pressure to do that. Also, you will probably have, without information such as this, you're going to maybe be living under anxiety, thinking, oh, I might get heart disease, my cholesterol is high, I got to deal with it, and for no good reason at all, because cholesterol levels in your blood have absolutely nothing to do with heart disease at all. So there's no fear in that at all. If you really do want to actually get a test done to that, you're wanting to see if you're susceptible to heart disease, atherosclerosis, or atherosclerosis, hardening of the arteries, or stroke. Good tests to do are the C-reactive protein, which is a marker for inflammation in the body, and heart disease is an inflammatory disease. You might want to get your C-reactive protein tested. Also, insulin levels in the blood is another one that's good to get tested. The insulin profile will show if you suffer from a metabolic syndrome, which basically means metabolic syndrome basically is an underlying condition for heart disease, and it's when you have high insulin levels, which is a result of high glucose levels. So a better test than getting your blood cholesterol tested is C-reactive protein, which is a marker for heart disease, and getting your insulin levels tested. I hope this was helpful. Definitely check out Dr. Campbell McBride's book, Put Your Heart in Your Mouth. It's been hugely impactful in my life. Even these things that I've known for quite a long time, it's just been a refresher to me, helping me to know that, encouraging me that, certain foods like butter, like they say, aren't bad at all. Eating things like egg yolks, definitely not bad at all. Having 2, 3, 4 a day, not bad at all. And all those types of things. It's just, we need to be educated on the stuff that if we're going to be living long, we're going to be living strong, we've got to be eating the natural foods that God intended us to eat in the beginning. Not these processed, broken down, denatured, damaged foods that are leading to all sorts of myriad of health conditions. So hope that helped. If you have any questions, drop a response down or comment down at the bottom, or send me an email. I'd love to help you out. All right, till next time, talk to you later.